Question 1. You are called to a 55-year-old male complaining of sudden onset chest pain that started an hour ago. He describes the pain as a pressure in his chest, radiating to his left arm. He is pale, diaphoretic, and states he feels nauseous. His blood pressure is 140/90 mmHg, heart rate 92 bpm, respiratory rate 18 bpm, and SpO2 96% on room air. What is your most appropriate initial action? A. Administer 324 mg of aspirin. B. Administer nitroglycerin sublingually. C. Initiate transport immediately to the nearest cardiac center. D. Obtain a 12-lead electrocardiogram, ECG. Answer: D. Obtain a 12-lead electrocardiogram, ECG. This question assesses your understanding of immediate priorities in a suspected cardiac emergency. The keywords sudden onset chest pain, pressure, radiating to left arm, and associated symptoms like pale, diaphoretic, nauseous strongly suggest a cardiac event, potentially a myocardial infarction, heart attack. While aspirin is important and transport is necessary, obtaining a 12-lead ECG is the most critical initial diagnostic step for determining the presence of an ST elevation myocardial infarction, STEMI, which dictates time-sensitive reperfusion therapy. For example, identifying a STEMI quickly allows for early notification of the hospital, preparing them for immediate cardiac catheterization. Always prioritize gathering critical diagnostic information that can directly impact definitive treatment for serious conditions. Question 2. A 24-year-old male has fallen 15 feet from a ladder and is complaining of severe back pain. He is conscious and alert. What is your primary concern regarding spinal immobilization for this patient? A. That any movement could worsen a potential spinal cord injury. B. His current complaint of severe back pain makes immobilization unnecessary. C. That full spinal immobilization is no longer recommended for falls of this height. D. Ensuring transport is expedited to prevent complications from the fall. Answer: A. That any movement could worsen a potential spinal cord injury. This question focuses on the core principle behind spinal immobilization in trauma. The keywords fallen 15 feet and severe back pain are red flags for potential spinal injury, even if the patient is conscious. The primary concern is always to prevent secondary injury to the spinal cord, as unnecessary movement could potentially exacerbate an unstable vertebral column or cause new neurological deficits. For instance, carefully securing the patient to a long backboard or vacuum mattress, while maintaining manual inline stabilization, helps prevent such detrimental movement. Remember, the goal of spinal precautions is to protect the nervous system from further damage. Question 3. What is the most appropriate method for ventilating an adult patient who is apneic with a pulse, according to current basic life support guidelines? A. Mouth-to-mouth ventilation at a rate of 10 to 12 breaths per minute. B. Bag mask ventilation at a rate of 1 breath every 5 to 6 seconds. C. Bag mask ventilation at a rate of 1 breath every 3 to 4 seconds. D. Oxygen-powered ventilator at a rate of 20 breaths per minute. Answer: B. Bag mask ventilation at a rate of 1 breath every 5 to 6 seconds. This question tests your knowledge of ventilatory rates for an adult in respiratory arrest but still with a pulse, which is a fundamental concept in basic life support. The keyword apneic with a pulse signifies the need for rescue breaths without chest compressions. According to current guidelines, including those reinforced in 2025 updates, an adult patient in respiratory arrest should receive 1 breath every 5 to 6 seconds, or about 10 to 12 breaths per minute. This rate helps ensure adequate oxygenation without causing hyperventilation, which can be detrimental by increasing intrathoracic pressure and reducing venous return to the heart. Always aim for slow, deliberate breaths for adult rescue breathing to ensure effectiveness and avoid complications. Question 4. During the primary assessment of an unresponsive medical patient, after ensuring scene safety, what is the immediate next step? A. Rapid trauma assessment. B. Obtain a full set of vital signs. C. Assess the patient's airway and breathing. D. Initiate transport to the nearest emergency department. Answer: C. Assess the patient's airway and breathing. This question tests your understanding of the critical sequence in the primary assessment. The keyword immediate next step after scene safety for an unresponsive medical patient points directly to the core ABCs: airway, breathing, circulation. While vital signs and transport are important, securing a patent airway and ensuring adequate breathing are always the most immediate life threats to address after confirming the scene is safe. For example, an unresponsive patient may have an occluded airway due to the tongue, which must be corrected immediately, or they may require assisted ventilations. Always follow the systematic approach of assessing and managing threats to airway, breathing, and circulation in that order. Question 5. You arrive on scene to a single vehicle collision where the driver is entrapped. As you approach the vehicle, you notice smoke coming from under the hood. What is your most appropriate immediate action? A. Attempt to rapidly extricate the patient. B. Request the fire department to deploy a hose line. C. Establish a safe zone and ensure scene safety. D. Begin assessing the patient's injuries through the window. Answer: C. Establish a safe zone and ensure scene safety. This question evaluates your understanding of scene safety, which is the paramount concern upon arriving at any emergency incident. The keywords smoke coming from under the hood indicate a significant and immediate hazard that could escalate to a fire or explosion. Before any patient care begins, ensuring the safety of yourself, your crew, and bystanders is absolutely critical. For example, you would establish a safe perimeter, consider positioning your ambulance safely, and alert the fire department of the specific hazard. Never proceed with patient care until the scene is confirmed safe to operate in. Question 6. A 68-year-old female complains of sudden dyspnea and sharp, localized chest pain that worsens with breathing, following a recent surgical procedure. She has clear lung sounds bilaterally. Which condition should be high on your suspicion list? A. Pneumonia. B. Myocardial infarction. C. Spontaneous pneumothorax. D. Pulmonary embolism. Answer: D. Pulmonary embolism. This question tests your ability to recognize the classic presentation of a pulmonary embolism, a life-threatening condition. The keywords sudden dyspnea, sharp, localized chest pain that worsens with breathing, and recent surgical procedure are all highly suggestive of a pulmonary embolism, PE. Patients who have recently undergone surgery are at increased risk for developing blood clots that can travel to the lungs. While other conditions might cause chest pain or dyspnea, the specific combination of symptoms and the risk factors strongly point towards PE, especially with clear lung sounds ruling out fluid or consolidation. Always consider a pulmonary embolism in patients with sudden unexplained shortness of breath and chest pain, especially if they have risk factors like recent surgery or prolonged immobility. Question 7. What is the primary purpose of administering epinephrine via an autoinjector to a patient experiencing a severe allergic reaction? A. To lower blood pressure and reduce swelling. B. To relax bronchial smooth muscles and constrict blood vessels. C. To sedate the patient and calm their anxiety. D. To thin the blood and prevent clot formation. Answer: B. To relax bronchial smooth muscles and constrict blood vessels. This question evaluates your understanding of epinephrine's critical physiological effects in an anaphylactic reaction. The keyword severe allergic reaction indicates a life-threatening condition where the body's immune system overreacts, causing widespread vasodilation, blood vessel widening, and bronchoconstriction, airway narrowing. Epinephrine directly counters these effects by stimulating alpha and beta adrenergic receptors, which causes blood vessels to constrict, raising blood pressure, and relaxes the smooth muscles in the bronchioles, opening the airway. For example, this rapid reversal helps prevent circulatory collapse and respiratory arrest. Epinephrine is truly a life-saving medication in anaphylaxis due to its dual action on both the circulatory and respiratory systems. Question 8. A 3-year-old child presents with a sudden onset of high-pitched stridor, drooling, and difficulty swallowing, without a preceding fever. The child appears anxious and is sitting upright in a tripod position. Which condition is most likely? A. Croup. B. Epiglottitis. C. Foreign body airway obstruction. D. Bronchiolitis. Answer: C. Foreign body airway obstruction. This question assesses your ability to differentiate between pediatric respiratory emergencies based on key clinical signs. The keywords sudden onset, high-pitched stridor, drooling, difficulty swallowing, and without a preceding fever are strong indicators of a foreign body airway obstruction. Unlike epiglottitis or croup, which typically present with fever and viral prodromes, a foreign body obstruction is abrupt and often lacks signs of infection. For example, a child may have been playing with small toys or eating candy when symptoms suddenly began. Always suspect a foreign body airway obstruction in a child with sudden onset respiratory distress and stridor, especially in the absence of fever. Question 9. When performing chest compressions on an adult, what is the recommended depth and rate according to current American Heart Association (AHA) guidelines, reinforced in 2025 updates? A. At least 1 inch 2.5 centimeters deep at a rate of 80 to 100 compressions per minute. B. At least 2 inches 5 centimeters deep but no more than 2.4 inches 6 centimeters at a rate of 100 to 120 compressions per minute. C. At least 2.4 inches 6 centimeters deep at a rate of 90 to 110 compressions per minute. D. At least 1.5 inches 4 centimeters deep at a rate of 120 to 140 compressions per minute. Answer: B. At least 2 inches 5 centimeters deep but no more than 2.4 inches 6 centimeters at a rate of 100 to 120 compressions per minute. This question tests your knowledge of the precise parameters for high-quality adult CPR, a crucial skill for all EMTs. The keywords adult, chest compressions, and recommended depth and rate refer to the specific guidelines that maximize blood flow during cardiac arrest. Current AHA guidelines, which are consistently reinforced, stipulate a compression depth of at least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters and a rate of 100 to 120 compressions per minute. For example, this optimal range ensures adequate perfusion to vital organs like the brain and heart. Maintaining proper depth and rate is paramount for effective chest compressions. Question 10. A 72-year-old female is experiencing altered mental status and slurred speech. Her blood glucose reading is 50 milligrams per deciliter. The patient is conscious but unable to follow commands reliably. What is your most appropriate immediate intervention if your scope of practice allows? A. Administer oral glucose. B. Administer 50% dextrose, D50, intravenously. C. Administer glucagon intramuscularly. D. Provide high-flow oxygen via non-rebreather mask. Answer: B. Administer 50% dextrose, D50, intravenously. This question addresses the management of hypoglycemia, low blood sugar, in a patient with altered mental status. The keywords altered mental status, slurred speech, and blood glucose reading is 50 milligrams per deciliter clearly indicate hypoglycemia, a medical emergency. Since the patient is conscious but unable to follow commands reliably, they are at risk of aspiration, making oral glucose unsafe. Intravenous D50 is the fastest and most effective way to raise blood glucose in an adult who cannot safely swallow. For instance, administering D50 can rapidly reverse neurological deficits caused by lack of glucose to the brain. Always prioritize immediate and safe administration of glucose in symptomatic hypoglycemia. Question 11. You are assessing an 8-year-old child with a respiratory rate of 40 breaths per minute, heart rate of 140 bpm, and noticeable intercostal retractions. His SpO2 is 90% on room air. What is the child exhibiting signs of? A. Compensated shock. B. Respiratory failure. C. Mild respiratory distress. D. Decompensated shock. Answer: B. Respiratory failure. This question tests your ability to identify signs of impending respiratory failure in a pediatric patient. The keywords respiratory rate of 40, intercostal retractions, and SpO2 of 90% on room air in an 8-year-old are all significant indicators. While a respiratory rate of 40 might be compensatory for mild distress, the presence of intercostal retractions, signs of increased work of breathing, and particularly an SpO2 of 90% suggests that the child's compensatory mechanisms are failing to maintain adequate oxygenation, indicating respiratory failure. For example, a child this age should not have significant retractions or such a low SpO2 if they are only in mild distress. Recognize these signs as a critical need for immediate ventilatory support. Question 12. A patient presents with warm, dry skin, absent sweating, and altered mental status after working outside on a hot day. Their core body temperature is significantly elevated. What is the most appropriate initial treatment for this patient? A. Administer large amounts of oral fluids. B. Administer an antipyretic medication. C. Rapidly cool the patient with wet cloths and fanning. D. Encourage rest in a cool environment. Answer: C. Rapidly cool the patient with wet cloths and fanning. This question describes a classic presentation of heat stroke, a life-threatening emergency. The keywords warm, dry skin, absent sweating, altered mental status, and significantly elevated core body temperature are defining features of heat stroke. Unlike heat exhaustion, heat stroke is characterized by the failure of the body's thermoregulatory system to sweat, leading to rapidly rising core temperatures that can cause organ damage. Rapid cooling, such as with wet sheets, ice packs and groin/axilla, or fanning, is the most crucial immediate intervention. For example, immerse the patient in a cool bath if available and feasible, or actively cool them while transporting. Immediate and aggressive cooling is essential to prevent permanent organ damage and death. Question 13. What is the term for a patient's breathing pattern characterized by an irregular pattern of increasing and decreasing rate and depth of breathing, interspersed with periods of apnea, often seen in stroke or head injury patients? A. Kussmaul respirations. B. Cheyne-Stokes respirations. C. Biot's respirations. D. Agonal respirations. Answer: B. Cheyne-Stokes respirations. This question tests your knowledge of abnormal respiratory patterns and their association with specific medical conditions. The keyword irregular pattern of increasing and decreasing rate and depth of breathing, interspersed with periods of apnea, precisely describes Cheyne-Stokes respirations. This pattern is often associated with brain injuries, strokes, or congestive heart failure. Kussmaul respirations are deep, rapid breathing associated with metabolic acidosis, while Biot's respirations are irregular breaths with unpredictable periods of apnea, and agonal respirations are gasping breaths seen in cardiac arrest. Recognizing Cheyne-Stokes respirations alerts you to potential underlying neurological or cardiovascular compromise. Question 14. Which component of the patient assessment is most important for identifying potential hazards and determining the mechanism of injury before approaching the patient? A. Primary assessment. B. Scene size up. C. Detailed physical exam. D. Focused history and physical exam. Answer: B. Scene size up. This question focuses on the foundational step of any emergency call, the scene size up. The keywords identifying potential hazards and determining the mechanism of injury before approaching the patient directly define the purpose of this initial phase. The scene size up is a critical, ongoing process that begins the moment you arrive on scene and ensures the safety of EMS personnel and the patient. For example, recognizing downed power lines or leaking fuel during the size-up would dictate a different approach than a simple fall. Always prioritize completing a thorough scene size-up to ensure safety and gather crucial initial information for patient care. Question 15. A 45-year-old male is experiencing severe abdominal pain localized to the right lower quadrant. On palpation, he exhibits rebound tenderness. What is the most likely cause of his pain? A. Cholecystitis. B. Appendicitis. C. Diverticulitis. D. Pancreatitis. Answer: B. Appendicitis. This question tests your ability to correlate abdominal pain symptoms with common medical conditions. The keywords severe abdominal pain, localized to the right lower quadrant, and rebound tenderness are classic indicators of appendicitis, which is inflammation of the appendix. Rebound tenderness, pain that worsens when pressure is removed, is a key diagnostic sign. Cholecystitis typically causes pain in the right upper quadrant, diverticulitis usually in the left lower quadrant, and pancreatitis often presents with epigastric pain radiating to the back. When assessing abdominal pain, pay close attention to the specific location and accompanying signs like rebound tenderness. Question 16. What is the primary reason for ensuring full chest recoil during cardiopulmonary resuscitation, CPR? A. To minimize patient discomfort. B. To allow the heart to adequately refill with blood between compressions. C. To prevent hyperinflation of the lungs during ventilation. D. To reduce the risk of rib fractures. Answer: B. To allow the heart to adequately refill with blood between compressions. This question addresses a critical aspect of high-quality chest compressions in CPR. The keyword full chest recoil highlights the importance of allowing the chest to fully decompress after each compression. This allows the heart to completely refill with blood, which is essential for maximizing cardiac output, the amount of blood pumped by the heart, with the next compression. Without full recoil, venous return is diminished, and less blood is available to be pumped to the vital organs. For example, if you don't allow the chest to fully recoil, you're essentially squeezing an empty chamber, making the compressions less effective. Always ensure complete chest recoil to optimize blood flow during CPR. Question 17. You are assessing a patient who was in a motor vehicle collision. They are unconscious and have snoring respirations. What is your most appropriate immediate action to manage their airway? A. Insert a nasopharyngeal airway, NPA. B. Perform a head tilt, chin lift maneuver. C. Perform a jaw thrust maneuver. D. Intubate the patient immediately. Answer: C. Perform a jaw thrust maneuver. This question tests your understanding of airway management in a trauma patient. The keywords motor vehicle collision, unconscious, and snoring respirations strongly suggest a potential spinal injury and an airway obstruction caused by the tongue falling back. In such cases, the jaw thrust maneuver is the preferred method for opening the airway because it minimizes cervical spine movement, unlike the head tilt, chin lift. For example, Gently lifting the angles of the jaw forward helps to move the tongue away from the posterior pharynx without hyperextending the neck. Always prioritize cervical spine protection when opening the airway in trauma patients. Question 18. According to current standards for pre-hospital care, when should a tourniquet be applied to control severe external bleeding? A. As the first-line treatment for all bleeding. B. Only after direct pressure and elevation have failed. C. For severe, life-threatening extremity hemorrhage that cannot be controlled by direct pressure. D. Never, as it can cause permanent tissue damage. Answer: C. For severe, life-threatening extremity hemorrhage that cannot be controlled by direct pressure. This question assesses your knowledge of current hemorrhage control guidelines, reflecting modern EMS practice and 2025 updates that emphasize rapid control of catastrophic bleeding. The keyword severe, life-threatening extremity hemorrhage is key. While direct pressure remains the initial preferred method for most bleeding, a tourniquet is indicated early for exsanguinating, life-threatening bleeding from an extremity that cannot be stopped by direct pressure or where direct pressure is not practical. For example, if a patient has spurting arterial bleeding from a limb and direct pressure isn't working quickly, a tourniquet should be applied immediately high and tight above the wound. Don't hesitate to use a tourniquet for uncontrolled life-threatening extremity bleeding. Question 19. You are treating a patient experiencing an acute asthma attack. They are alert but are having significant difficulty breathing, using accessory muscles, and have audible wheezing. Their SpO2 is 92%. What medication is typically administered first in this situation? A. Oral corticosteroids. B. Albuterol via nebulizer. C. Intravenous magnesium sulfate. D. Oxygen via nasal cannula. Answer: B. Albuterol via nebulizer. This question tests your understanding of immediate pharmacological intervention for an acute asthma attack. The keywords acute asthma attack, difficulty breathing, wheezing, and using accessory muscles point to bronchospasm, narrowing of the airways. Albuterol is a beta-agonist bronchodilator that works by relaxing the smooth muscles in the airways, rapidly opening them up. It is the primary first-line medication for acute asthma exacerbations. For example, delivering albuterol via a nebulizer or metered dose inhaler helps the medication reach the affected airways quickly, providing rapid relief from wheezing and shortness of breath. Always prioritize administering a fast-acting bronchodilator in acute asthma. Question 20. What is the most common cause of cardiac arrest in infants and children? A. Primary cardiac event. B. Traumatic injury. C. Respiratory arrest. D. Sudden infant death syndrome, SIDS. Answer: C. Respiratory arrest. This question highlights a fundamental difference in the etiology of cardiac arrest between adults and children. The keywords infants and children are crucial here. Unlike adults, whose cardiac arrest is most commonly caused by a primary cardiac event, example a heart attack, pediatric cardiac arrest is most often secondary to respiratory arrest or shock that progresses to cardiac arrest. This means the child stops breathing first, leading to a lack of oxygen that eventually causes the heart to stop. For example, severe asthma, pneumonia, or foreign body airway obstruction can lead to respiratory arrest, then cardiac arrest in a child. Focusing on early recognition and management of respiratory distress is paramount in pediatric patients. Question 21. A 30-year-old male is found unconscious with pinpoint pupils and shallow respirations at a rate of 6 breaths per minute. There are drug paraphernalia found nearby. What medication is indicated for reversal of his condition? A. Activated charcoal. B. Naloxone. C. Flumazenol. D. Epinephrine. Answer: B. naloxone? This question describes a classic presentation of opioid overdose. The keywords unconscious, pinpoint pupils, shallow respirations at a rate of 6 breaths per minute, and drug paraphernalia are all highly indicative of an opioid overdose. Naloxone, Narcan, is a specific opioid antagonist that rapidly reverses the effects of opioid narcotics, particularly the respiratory depression. For example, administering naloxone can quickly restore normal breathing and consciousness in a patient experiencing an opioid overdose. Always be prepared to administer naloxone to patients exhibiting signs of opioid overdose, especially with severe respiratory depression. Question 22. What is the appropriate initial management for a patient presenting with generalized tonic-clonic seizures? A. Restrain the patient to prevent injury. B. Insert an oral airway or bite stick into the patient's mouth. C. Move objects away from the patient and protect their head. D. Administer oxygen via non-rebreather mask and transport immediately during the seizure. Answer: C. Move objects away from the patient and protect their head. This question tests your knowledge of immediate care for a seizing patient, a common medical emergency. The keyword generalized tonic-clonic seizures refers to the full-body convulsive activity. The most important initial action is to protect the patient from injury by moving dangerous objects away from them and gently protecting their head, without attempting to restrain their movements. Inserting anything into the mouth can cause injury to the patient or rescuer. For example, if the patient is on a hard surface, you might place something soft under their head. Focus on safety and preventing secondary injuries during the seizure, allowing it to run its course. Question 23. You are transporting a patient with a suspected spinal injury who is experiencing increasing difficulty breathing. What is the most effective airway adjunct for this patient, if manual techniques fail and your scope allows? A. Oropharyngeal airway, OPA. B. Nasopharyngeal airway, NPA. C. Endotracheal tube, ETT. D. Supraglottic airway device, SGA. Answer: D. Supraglottic airway device, SGA. This question probes your understanding of advanced airway management options in a trauma patient with a suspected spinal injury. The keywords suspected spinal injury and increasing difficulty breathing indicate a need for airway control while maintaining spinal precautions. While an OPA or NPA can be used as initial adjuncts, if the patient continues to decline, a more definitive airway is needed. An endotracheal tube, ETT, requires significant head manipulation for placement, which is undesirable with a suspected spinal injury. A supraglottic airway device, SGA, is a good alternative as it can be placed with minimal or no neck movement, providing a secure airway for ventilation. For example, King LTs or iGel devices are types of SGAs that can be inserted quickly and safely without hyperextending the neck. Always consider an SGA when a definitive airway is needed in a patient with suspected spinal injury and standard techniques fail. Question 24. A patient has a laceration on their forearm that is actively bleeding in a steady, dark red flow. What type of bleeding is this, and what is your most appropriate initial action? A. Arterial bleeding, apply a tourniquet immediately. B. Venous bleeding, apply direct pressure with a sterile dressing. C. Capillary bleeding, cleanse the wound and bandage lightly. D. Internal bleeding, monitor for signs of shock and transport. Answer: B. Venous bleeding, apply direct pressure with a sterile dressing. This question tests your ability to identify different types of external bleeding and apply appropriate initial management. The keywords steady, dark red flow are characteristic of venous bleeding, which originates from veins. Unlike arterial bleeding, bright red, spurting, venous bleeding is generally easier to control. The most appropriate initial action for venous bleeding is to apply direct pressure with a sterile dressing. For example, firmly press down on the wound with a gauze pad or clean cloth until the bleeding stops. This method is highly effective for most venous and capillary bleeding. Question 25. What does the P in the sample history mnemonic stand for? A. Pre-existing conditions. B. Prescriptions. C. Past medical history. D. Pertinent negatives. Answer: C. Past medical history. This question tests your knowledge of the sample mnemonic, a fundamental tool for gathering patient history in EMS. The P in sample specifically stands for past medical history. This includes any relevant medical conditions, surgeries, or hospitalizations the patient has experienced. For example, knowing a patient's past medical history of diabetes or heart disease is crucial for understanding their current symptoms and guiding your treatment decisions. Consistently using mnemonics like sample helps ensure you gather all necessary information in a systematic way.